In a break from the usual YouTube video, I'm going to come straight out and answer the question posed in the video title. And no, the answer isn't, it depends this time. Between nasal and full face masks, which is better? Hands down, the answer is a nasal mask. And that goes for pretty much everybody. Don't worry, I'll get to you mouth breathers in a bit, as you're probably not an exception. But first, here's why nasal masks are better. Let's start with probably the biggest reason. They're much smaller and less intrusive. No one wants to wear a CPAP mask, let's be honest. But if you do need to wear one, it's much better for one to be small and light than big and bulky. So unless you're trying to look like Bane, a nasal mask is the way to go. But it's not just size and bulkiness. Full face masks encourage mouth breathing, but mouth breathing is a bad idea for a lot of reasons. Your nose is designed for breathing. It warms, moistens, and filters the air ready for your lungs to get maximum oxygen from it. But when you breathe through your mouth, none of that happens, causing dryness of the airways, which is unpleasant by itself, and it also leads to lower oxygen extraction, bad breath, and tooth decay, to name a few. But Ruben, I hear you say, I can't use a nasal mask. I need to breathe through my mouth, and besides, nasal masks increase my leak rate and make my nose sore. Well, if that's you, my friend, then keep watching for RespShop tips to ditching the full face and switching to a nasal. It can be done. The difficulties with switching from a full face to a nasal option usually comes down to one of three reasons. 1, the habit of mouth breathing. 2, difficulty exhaling, and 3, problems with air leaking. So let's start with the first challenge, mouth breathing. Did you know that no baby is a mouth breather? We instinctively breathe through our nose unless it is congested. So if you're a mouth breather, then you've become a mouth breather at some point in your life, which means you can unbecome a mouth breather too. It's all about changing your habits. But how do you change those habits? A good first step is to use a chin strap to train your jaw to remain closed while you sleep. If your mouth is closed, then you'll naturally start to breathe through your nose instead. That doesn't mean you'll be cursed to wear yet another thing over your head at night, because the chin strap is only required until you change your sleeping habits and start to naturally breathe through your nose instead. At which time, it's goodbye chin strap, and you can ping it in a bin like an old rubber band. Another way to make things easier to nose breathe is making sure your nasal passage is free of congestion, which basically means to keep it clear from mucus and boogers as much as possible. Sometimes if you have a lingering cold, this might not be completely possible, but often it is. You can try using a saline rinse before you sleep or a eucalyptus inhaler to clear the nasal passage of blockages. Then keep the congestion drainable by making sure the air pressure is moist and warm. There's nothing like cold, dry air for turning slippery mucus to rock like boogers, which are less likely to clear. Lovely conversation this. Oh, and to help the mucus drain from your nose in the night, try to sleep at an incline and off your back. Also, avoid sugary food or drink before bed, as they are inflammatory, which makes your nasal passage smaller. Follow these tips and you should have a clear and free-flowing nose, which is exactly what you need to stop that pesky mouth feeling like it needs to help out with your breathing. The second challenge is the increased difficulty people can have in exhaling when they're using a nasal mask. The reason it can be more difficult to breathe out is because there's less space in the mask to breathe out into, so you're more directly fighting against the incoming air pressure from your CPAP machine. But there are tips for solving this one as well, and they revolve around reducing the air pressure you need to fight against. The simplest first step is to crank up whatever exhalation pressure relief your machine offers. Most brands come with expiratory pressure relief options at various levels, and remember, the higher the number, the greater the relief. So if you find that this is a struggle, make sure this is as high as it can go. Next, if you're using a slimline tube, maybe swap it to a standard tube instead. The wider diameter means the velocity of the air is lessened, which makes it easier to breathe out against. You can also get a VCOM, which fits between your tube and mask and softens the air coming in and out of the mask by filtering it through smaller holes. Many say that these little devices can help with both noise levels and exhalation. Now, if this doesn't work, there are other temporary ways you can make exhaling easier as well by reducing the pressure coming to the mask further still. One pro tip is you can set the CPAP machine to the full face setting rather than actually matching your mask type. Doing this will have the machine reduce the baseline air pressure coming into the mask while maintaining its usual auto algorithm adjustments to therapy pressure. Similarly, you can reduce the maximum pressure setting you allow the algorithm to reach to make sure you never have to fight those high mask pressures when exhaling. Now, of course, if you do reduce the therapy pressure by these means, it may affect your AHI index a bit. and you shouldn't do anything like this without consulting a medical professional. But the idea here is to go back to the old settings once you're more used to using the nasal mask. And at this point, you should then get the benefits of both the ideal therapy pressure settings and the ideal mask type to avoid the therapy affecting consequences of a full face mask. The final challenge of using a nasal mask is to get on top of your leak rate. If you've tried a nasal mask and had leak problems in the past, then it's probably because you were using a nasal cradle mask where the air enters your nose through slits or holes in the mask cushion that rest under your nostrils. In which case, the solution is to use a nasal pillow mask instead, as they have much better seals because they go inside your nostrils. In fact, nasal pillow masks typically offer better seal than full face masks. Some find nasal pillow masks can be sore on the nostrils, and that's because the pillows can rub on the inside of the nose and because it means that air is being pushed through in jets that can penetrate straight into your nasal cavity. If you follow the pressure reducing tips I just mentioned, that should help with the jets of air problem. And to make the switch to a nasal mask easier, we suggest you alternate between using a nasal pillow mask and your old full face mask for a bit until your nostrils get used to the pillows. If your nose is sore, wear the full face mask that night to give them a rest. And once they've recovered, go back to the nasal pillows. Or after a while, your nostrils should actually harden and the soreness will stop. And at that point, you can use the nasal pillows full time. If you follow the tips and advice I've just given you and you persevere with them, the vast majority of users will be able to make that switch from a full face mask to a nasal mask. And once you do that, you should find that you get a more comfortable and more effective sleep, along with reductions in the health risks that accompany mouth breathing. And that is worth every night of frustration you may need to endure in the meantime. So from all of us here at RespShop, best of luck with the switch, and in the meantime, as always, sleep tight. Bye-bye for now.